we're going to have Dr. Hallas from Sterngold. Awesome. So we are going to learn so many different things that are out there in the dentistry space. Sterngold has been an awesome key resource, collaborator, sponsor of what we do, make a lot of amazing products. Their team is great. We're lucky to have Dr. Hallas here with us. Dr. Hallas, thanks for being on the show with us. Share with us what you do and how you guys help dentists.
Thank you for having me. Coming from Marquette, Michigan today. I have 3 offices up in Marquette, Escanaba, and Green Bay. So I have kind of a lot of windshield time for doing dentistry across almost 400 miles.
Wow.
Between our offices.
What do you listen to on those drives? Do you a podcast or?
You know, it's actually a lot of thinking time, kind of like what you said about treatment planning, team decisions. I have a partner that I got to talk to. I got other referring dentists. So it actually gives you alone time to do dentistry.
I like that. Yeah, alone time. You're just centered. See, I'm getting myself centered. So that's awesome.
You just got to dodge deer right now. They're on the move. You know, it's a little hostile environment. So, but no, I can't. We can't complain.
Awesome. What do you do with Sterngold, and how does what you do with them help our dentisting community?
So I'm a trained prosthodontist with a surgical and restorative background. I did my training at UIC. I graduated in 2010 and then came out. And then through a bunch of different lectures I had previously done, I ended up meeting Gordon with Sterngold, and he asked for some collaboration. So currently what we're working on is it's releasing next week is their new streamlined surgical kit that tapers to the Pure and the TRU implant. They have new packaging coming out that we've worked on that includes basically all parts included. So you get your implant, you get all of your restorative components, whether you're doing single tooth or an overdenture. They have their Stern Snap, they have their locator partnership now. So there's a lot in the works right now.
Also, appreciate you sharing that. I want to ask you a little more about your dentisting life as a superhero, but I just want you to text Stern to 55444. You'll find out more about our key resource and sponsor. So dental implants is a huge part of what we do. And I have a surgical prosthodontist, really amazing guy, graduated a few years ago from UConn, who's in our practice. And I see the value of planning implants yourself, restoring them, also collaborating when that's necessary. Tell us a little bit about, your dentisting life with placing and restoring implants on your own. What's a typical day look like for you?
There's not a day that goes by that we're not either working with our oral surgeon or placing implants in our practice. Each office has CT scanners. I mean, they're going daily. It's the future. I mean, implants are truly life-changing for patients, kind of like what you showed with the overdenture. I mean, taking a basic denture, increasing the retention and the stability to give a patient more comfort and confidence to actually eat peanuts is game-changing.
Yeah,
I mean, it's game-changing.
I have to say, you were a prosthodontist, signed up to be one of our superhero dentists, but how many times, Dr. Hallas, in your career, when did you graduate dental school, from dental school?
Dental school 07, pros 2010.
So in 10 years, how many times has a patient leapt up from the chair after you've done a class 2 on 14 and said, thank you for all the care that you put into this class 2? I'm still waiting, but maybe that's happened to you.
We don't even do composites. They're overrated.
But dental implants are a fun part that's good for the patient, the team, you, and profit driven. It changes people's lives. What people say to me is, I should have done this sooner. It's all about how do you get the patient started on this journey, whether you're referring and having someone else place them. I know dentists love details, Dr. Hallas, and you're here as this superhero prosthodontist who places implants. From the Sterngold line, which implants are you using for which situation?
So we use the TRU in our system in our office, primarily because I use Nobel BioCare in my office, and I use the Sterngold TRU. They have the same compatibility head, so the restorative components are the same. But not everybody can afford all of our fees. So it allows us to have a different value in our practice. And it also gives us a different expanded line, especially, we do a lot of dentures. I get a ton of referrals from general dentists doing dentures. Nobody really likes doing dentures, but doing a mandibular overdenture for a patient, that's game changing. Yeah. I mean, you increase their biting force 50, 60%. So if you have a value-based system that allows us to do this in an affordable and streamlined manner, that's a no-brainer.
And that's such an important point what you shared is that I really don't like our dental school training where they teach you one thing's great and the other thing stinks. I mean, you just talked about 2 different implants that you use for 2 different scenarios, much like if you go and get a regular margarita and maybe one with top shelf tequila. They're both good, but maybe somebody wants to invest in this. And we should say we have good and great. I mean, I talk about maintaining teeth as tacos, doing implants as nachos. Only us dentists, Dr. Hallas, could argue over a root canal and crown that works out well 9 out of 10 times and an implant that works out 9 out of 10 times. If our patients heard us arguing, they'd be like, you guys have problems. We'd be like, I know, we do have problems. We offer 2 great solutions, so I appreciate you sharing that with us. One of the things I could add value here, and maybe even you can use, is that when patients say to me, why do I need implants for my overdenture, for my denture? I say dentures without implants are for smiling, not chewing. So if you want to smile and beat your granddaughter's play and look like you have teeth, great. If you want to go to the after party and eat the chicken parm, that denture's not doing. They really get that. Dentures without implants are for smiling and not chewing. And that's a point. So I appreciate you sharing with us. To reach out to Sterngold and learn more, just text Stern to 55444. Their team with Gordon and Helga are great. We've had some great shares here. Before we let you go back to your patients, Dr. Hallas, anything else you'd like to share with us about Sterngold, your life, guacamole, nachos, anything like that?
As I see it, kind of what you said is there's a good system, right? And then there's a great system, but there's a medium. And truly figuring out where those systems meet for the patient to give them value is truly what we need to do. And that's what the Sterngold does in our office, is it gives us a value that we can't achieve with certain things, and change that patient's daily routine, allow them to eat.
It's true. We like to go to restaurants and have multiple toppings, so we just have multiple options. We don't have to be so dramatic about it. How it fits into your business model, your patient flow production. So I appreciate you sharing about that. Enjoyed getting to know Sterngold and what they offer. We appreciate you sharing about their implant systems. What are you doing next after this show?
We are putting in some implants.
Oh, nice. Right. See, that's the big reveal, They get the implant and they start chewing away. So I'm sure you're going to make a patient happy, and thanks for being on here, and have a great rest of the day.
Awesome. Have a good day. Nice meeting you.
Thanks, Dr. Hallas. Nice meeting you too.